Hey guys, it's Brenda. I thought I would give you a little glimpse into how I clean my feeding tube. My feeding tube gets cleaned a couple times a day, and if it's messy, sometimes it gets cleaned numerous times a day. I am not a nurse, and I am not a medical professional. And this is not a tutorial on how to clean your feeding tube. I am simply showing you the way that I care for my feeding tube and clean it. So if any of you have a feeding tube and you're watching this, if you have any questions about your feeding tube or the care of your feeding tube, I suggest that you speak with your doctor or the surgeon that put your feeding tube in. So let's get started. This is my feeding tube. I have a G tube and a J tube. The G tube goes into my stomach and the J tube goes to my jejunum, which is halfway through my small intestine. So the way that I clean my feeding tube is I have to start off with some supplies. I use some sterile cotton-tipped applicators. It's basically a Q-tip with a long stick. Next, I get an IV sponge. This is basically a 2x2 with a slit down it so that you can put your feeding tube around. You can wrap it around your feeding tube. Next, I get some sterile 2x2 gauze. I get a clean G-pad. And I get a clean mesh bag that you can just throw into the washing machine. And to clean my feeding tube, I use Medline Skintegrity Wound Cleaner, and this stuff works wonderful. Insurance doesn't cover it, but it works great. And then to make sure that I don't have any infections or any issues with my feeding tube, I use the Medline Remedy Phytoplex Z-Guard paste. And I just put a tiny little bit of this around my tube where it goes into my stomach, just to make sure that I don't have any redness, infection, or any issues. So let's get started. The first step is to take off your old dirty G-pad, and mine just unsnap. And I use the garment bag, and that's what I put my dirty G-pads into. That way all I have to do is toss this into the washing machine. Next, I take off the old IV sponge, and that goes into the garbage. So now I am left with my feeding tube and the hole that goes into my stomach, which is called a stoma. And before this procedure, make sure you've washed your hands. Doing procedures with a feeding tube, cleaning it, putting medicine through it, or starting a feed is not a sterile process like it would be for a central line, a port, things like that. So basically you need to have clean hands, and you can move forward. So next I'm going to open up a couple of my gauze sponges. And I am going to get my Medline Skin Integrity Wound Cleaner, and I'm just going to spray it all the way around my feeding tube where the stoma starts. And I'm going to use one of these to kind of catch all the little drips. I spray underneath it, on the sides of it, all the way around it, so that it's wet, so that I can clean it up. There's a little bit of the Z-Guard paste residue left, so I'm just making sure to clean that up as well. Okay, this one is a little messy, so I'm going to use my other sterile gauze pad here. Okay. That can go into my garbage pile. Now you can see that I have a very clean, what's called a stoma, which is this hole that goes into my stomach. It's all nice and clean. There's no residue around there. There's no redness. It looks great. So now I'm going to open up my last 2x2 gauze. One of the general rules with a feeding tube is that you keep it very, very dry. Leaving it damp and moist can cause granulation tissues, redness, swelling. That gets extremely uncomfortable. So I always take one of these once I'm done cleaning it, and I kind of pat all the way around the stoma to make sure that it's nice and dry. Okay, once you know that you have it all nice and dry, we can go ahead and open up the IV sponge. And if you can see, this is basically a 2x2 with a slit so that this can be wrapped around my feeding tube. Now that I have that open, I'm going to open up one of the sterile cotton-tipped applicators. Make sure that you don't touch the end of this. It is sterile and it will help so that you don't have any infections or anything. Next, I'm going to put a little bit of the Medline Remedy Protectant Z-Guard paste onto the cotton-tipped applicator. Doesn't take very much. Now make sure that once you put this around your feeding tube, if you need to get a little bit more out of the container, I make sure that I get another sterile cotton tip applicator so that I'm not double dipping. And I am just going to carefully put this around. Okay, once that's all nice and coated, you can go ahead and get your IV sponge or your split gauze. And I tend to go from the bottom and then wrap it around. And it seems to stay in place. I haven't had any issues with it. So next I put on my clean G-pad. And snap it. Make sure it's all folded down. And nothing is folded up underneath to agitate the tube. And that's it. I do this a couple times a day, or every time it decides to leak or make a mess. It's very simple. I haven't had many issues at all with my feeding tubes, so my process seems to work, but that's all I have. So I hope y'all have a great day. Thanks.